And also we have to check the nutritional assessment. Nutritional assessment also very, very important during the the diagnosis of the person health status. So this nutritional assessment, including the taking the anthropometric measurements and collecting information about the client medical history, clinical and also biochemical characteristics, dietary practice, and current treatment and food security situations. So this is the very, very important while giving the treatment plan and checking the any biochemical analysis or maybe any dietary practice and any current treatment progression or any food scrutiny. We have to check the nutritional assessment. And also optimal nutritional status. So we have to understand, if you assess properly, so we can assess the people who are having the abnormal a nutritional deficiencies. That means if any malnutrition or also overnutrition or maybe is a extra calories accumulation, so we have to check with the proper nutritional assessment. Because of nowadays many people are interested to reduce their weight, or if they want to become slim or become they want to reduce the weight, so they have to know their nutritional status. According to the nutritional status, the physical trainers and also exercise therapists, they're going to plan their regimes, their exercise plans according to the nutritional status. And also who want to reduce the fat or weight loss, so 10% or more has been associated with adverse outcomes. So 10% weight loss within the short duration may use the adverse effect. So it should be prolonged time within the months together. So if they lost the 10% weight with exercises and proper diet, it won't harmful to the body. But if it's sudden loss of the 10% of the body weight in the short durations, so they may chance to get the side effects and also other complications. If the body weight is more than 35%, so sudden loss of the 35%, so the person may chance to die, is associated with the death. So that are the causative factors. So that is the reasons. So we have to rule out the weight loss, and also we have to check the nutritional status of the persons. And also nutritional status affects the immune response and also response to medical therapies. So that is the reasons who are having some nutritional deficiencies, so the immune system also may affect. So if any disease affects, so it may chance to get the other complications. In this pandemic situation, many people are faced with the immune deficiencies. So who have a nutritional deficiency, they exposed to the a COVID-19 and also got the severe complications. Who have a strong immunity power, so they are survived and also they are fight with the COVID easily and also overcome the COVID-19. So that is an important thing, and also about the nutritional assessment and also importance of the nutritional assessment. So how we can do what is the purpose of this nutritional assessment? So main thing is to identify the people risk of malnutrition for early intervention or referral before become the malnutrition. So that means we have to identify who are having the malnutrition symptoms, or if anybody having any other issues related to the nutrition. And also to identify the malnutrition client for the treatment. Malnutrition people who are not treated early have longer hospital stay, is a slower recovery from the infections and complications, and higher morbidity and mortality. Who have this nutritional deficiency, malnutritions, if anybody gets symptoms or any health issues, so they have to stay in the hospital prolonged time, and also may chance to get the complications, may chance to get the mortality, because of the immune system also going to be affected. And also with these three things, we are going to track the child growth, how the child improvement. Just now we discussed how the improvement, the height and weight is going to be changed, altered according to the growth. And also to identify the medical complications that affects the body ability to digest food and utilize the nutrients. Sometimes we have to check the nutritional status, how the food is digested, how the food is absorbed into the digestive system. Some who already having some deficiencies, whatever they take the nutritious food sometimes it may not absorb inside the stomach. Or some people having some deficiencies like a protein deficiency, malnutrition, or maybe some people B complex vitamin deficiencies because of the malabsorption, or maybe because of the malabsorption maybe we can commonly see in the who have like a vitamin B12 deficiency or B complexes in severe alcoholic persons. So this type of we can easily identify, and also we can easily understand about the abnormality of the nutritions. And also next one is to detect the practice that can increase the risk of the malnutrition and also infection. So we can easily detect the malnutrition and also infections. To inform nutrition education and counseling to establish the appropriate nutrition care plans. So if we assess properly, we can easily assess and also plan treatment easily. So how to assess this nutritional screening? So we can go by the detailed manner. So it takes a prolonged time and also it takes time, but simple screening also helpful to identify if any patient comes within the like a fraction of seconds. We can see some important major things, or maybe within the short durations we can find out the major issues, such as if a person having the bilateral pedal edema, or if anybody having edema, both legs are edema. So and also we can easily pale, the person is pale, not active, and also we can easily identify this small simple screening. So that is a pitting edema. So if you press the legs, so it may get the some depression and shallow, and also this will indication of the malnutrition. Along with this bilateral pitting edema, and also we have to check the measure of the weight and also mid upper arm circumference. So here we have to check for the mid upper arm circumference. So if the 24 centimeters or this 220 is going to be the normal. So we can see the some scale measurement is there, that is the mid upper arm circumference. So it should be is the 22 centimeters. So if anybody having less than this one, so what happened? Nutritional deficiency, the muscle size is going to be decreased. That is, a muscle becomes thin or wasting. Muscle wasting will be there. And also if any person comes, we have to ask for the any previous like abnormalities related to the health, any recent illness, or maybe is there any loss of appetite, or maybe over like eating disorders. So we can easily understand about this, the simple history taking and also simple measurement. We can take the we can rule out the causative factor for the malnutrition. And also the classical features of the nutritional deficiencies. So these deficiencies we can identify with the small simple symptoms. If the person body weight is decreased and also muscle size is decreased, so which is called as the atrophy of the muscle becomes thin. If you see, the normal muscle is the bulky, and also the muscle tone will be the normal and tension in the muscle. But if you see in the abnormal muscles, that is the atrophy of the muscle become weak, and also the muscle become very thin. So this is also one of the classical sign of the malnutrition. And also other nutritional like a signs, important signs are the hair loss. So they may chance to get the hair loss. We can feel the hair loss, and also so much of space, and also alopecia, also called as alopecia. Or maybe we can see the hair color is going to be changed. So in the age, if the less than 20s and the 30s also, nowadays is getting the hair like a color is going to be changed. This is a white color. So because of so many reasons, this color change, maybe because of the nutritional deficiency, or because of the pollution, because of the stress, and because of the dietary. So all are going to be affect. So these are the signs of the classical signs of the vitamin deficiencies.